Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Cohen Children's Medical Center to help you navigate through what's going on with COVID-19 in our communities and, of course, across the regions. And we want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. All right, let's get right to the numbers because those infected keep rising, and sadly, so does the death toll. Governor Cuomo today announced New York State has lost 285 lives from this pandemic. Suffolk County now has 20 deaths after 3 elderly people with underlying medical conditions died yesterday. Nassau's death toll is now up to 17. That is 7 more since yesterday. The county executive says the latest victims all had underlying health conditions as well. Now, statewide, the total number, look at the total number right there, 30,811. And here in Long Island, numbers also soaring, more than 5,500 confirmed cases. Again, these are just the cases we know about. The governor touting new numbers that may show that these drastic social distancing measures is working right now. The governor says a few days ago the number of hospitalizations, that was doubling every 2 days. Now he says it's about every 5 days. And help is on the way for Long Islanders getting crushed by this crisis. The Senate has agreed in principle, hasn't voted yet, on an unprecedented economic relief bill to give direct payments to most Americans and expand unemployment benefits. That deal put together by the White House and the Senate, it's a $2 trillion relief package. It's meant to rush financial aid to businesses, workers, and healthcare systems struggling to stay above water amidst this pandemic right here. Now, of the $2 trillion, Governor Cuomo says we here in New York, we would receive $3.8 billion. However, he says that is just a drop in the bucket since we are currently the epicenter of this crisis nationwide. All right, let's get right to our conversation. Joining us tonight is Dr. Mundeep Kainth, a Pediatric Infectious Disease Specialist from Cohen Children's Medical Center. Thank you so much, Doctor. I know you all are working so hard tonight. You are a pediatric infectious disease specialist. Let me ask you this. I know China has about 2% of their population were infected, were children. Are those numbers panning out here in the United States? And do we know why children seem to not being infected at the same rates as adults?
That's a really great question. We have been having difficulty trying to understand the differences between children and adults, but we have some data from Seattle and from other parts of the country that are showing that they also have very low rates or no rates of infection in their children's hospitals. And so here in New York, we are seeing some children being infected. It could be because we have large numbers of adults infected, and that could be a reason why we're having children being affected in a different way than maybe other parts of the country. As you noted before, we have very high numbers, and in essence, that means that children could be more exposed to people who have COVID-19 as opposed to other parts of the country.
Now, are we testing enough? The president today said that we've tested more than any other country. We also have a larger population than the country that he was comparing us to. Are we testing enough right now?
So we are ramped up on testing currently. Most of New York is now in an automated system. At least down here at Northwell Health and at Cohen's Children's, we are at automated at this point, which means that we can do many more samples per day, which means that we are getting now probably real time an idea of what's happening, as opposed to in previous weeks where we may have been delayed on test results. We are certainly not seeing that right now, that this is pretty current and that we are able to test. Now, the question is, should we test folks who are not necessarily as sick and are staying at home? And that's been a very common question. If we do use our supplies, we would like to use them for people who are very ill in the hospital to really tease out if it is COVID-19 or another illness that's making them so ill. And if we have less supplies, we will be more concerned about testing the general population. But we are definitely seeing that both in the general population and in the hospitals, the numbers are rising with testing.
Okay, let's go right to the phone lines right now. Eileen from Old Brookville. Eileen, are you there?
Hi, how are you?
I'm doing great. What's your question tonight?
My question was a larger question, but as it pertains to you, doctor, as an infectious disease specialist, I'm a former math professor at NYU, and seeing this doubling rate is staggering, and seeing that 62% of the cases for all of New York State are focused in New York City. What are we doing as to lobby that New York City be quarantined and not pollinate the rest of the state, or in particular Nassau and Suffolk? I mean, there is a real emergency and crisis in New York City. How can we stop this pollination? And can maybe you explain to everyone this doubling rate? Because it is staggering. Once we get to big numbers, we can go from 1 million cases to 2 million cases in that period. And I don't think people really understand the magnitude of this. And I feel I see people walking around like it's nothing, people who have come in from Manhattan to my neighborhood, going around their business, and it really has been requested that they self-quarantine. People are just not doing it. A request isn't working. I think we need to mandate that New York City residents don't leave until this is dealt with, and it's just temporary. We're talking about 2 to 3 weeks to save everyone.
Okay, let me let the doctor respond to that. I know it's a policy question to some degree.
To some degree, it is a policy question, but I also believe that we need to, as the caller requested, educate our public a little bit more. So just to define doubling time, first of all, doubling time is basically the time in which the number of cases has basically increased by twice the number. So in China, the doubling time was noted to be about a week, which is why we're able to somewhat predict the doubling time in other parts of the world based on what's been going on in other places. Now, some places in the world have had a very high doubling, a low doubling time, meaning that they have had increases in cases that seem to exceed this or be less than this 7-day time. So maybe just a few days where they may be doubling in the number of cases. And there are lots of theories on how that's happening, but we definitely know that social distancing, as we heard earlier, is the way to sort of reduce that doubling time. The other important concept to understand is something called reproduction number, which means that how many people get infected when one person is sick. So if I get sick, I can infect 2 to 3 other people at minimum. That's the reproduction number. And that number has been as maybe low as 2, but has been estimated to be as high as 4 to 5. And that is where the scary part comes in, because yes, as if there's one sick person who decides to go out and meet another 5 people, they basically have guaranteed that most of those people will now be ill. So that's why we are trying to encourage folks to not have meetings of large groups of people. And as a pediatrician and a pediatric infectious disease doctor, and a mother, it's actually very difficult to sort of comprehend not having sort of that socialization. But New York City is a very compact area. There are people who live with each other in large numbers. So we also have to address the realities of the situation, that we have to make sure that our population is doing the best they can to make sure that they are socially distancing. And I really do appreciate that question, because that is one of the major points we'd like to get across to the public, to take these recommendations seriously. We do have a pause. The governor has put into effect policy that is supposed to reduce the number of people who are outdoors. Even myself, as a physician, when I'm not seeing patients, I'm supposed to be home and working from home. So this is an important thing for all of us to understand in the community, all the way down to children, to adolescents, young adults, and older adults as well.
Yeah, great advice, great comment. All right, let's go back to the phones. Nancy from Great Neck. Nancy, you there?
Yes, hi, thank you. I have a question that I haven't heard anybody address. I live in an apartment complex, and if someone is ill next to me, say their window is 6 feet from mine, and they have their window open, I know, for example, that my next-door neighbor, when they used to smoke over there, their smoke would come directly into my dining room window. Won't their germs be blown right in, too?
Great question.
So the 6 feet rule is actually a very important rule to know, that if you are more than 6 feet away from someone, the likelihood of you capturing virus and acquiring the infection is fairly low. So we know that those particles can last in the air for several hours, about 3 hours from the latest studies. But I think it's important to note that if you're in a complex versus where you are in the same room, or for example, in an apartment building versus the same room, that means that the virus has many places to travel, not just in one direction towards one person. So it's important to basically keep your windows open for fresh air, but not necessarily worry about the airborne potential or the potential of that virus being in the air, if you're basically have an open space in between those two places, because it's not intentional or directional for the virus for where it travels.
Okay. Back to the phone lines. Rosemarie from Rocky Point.
Yes, my question is, when someone has a mild, like a majority have mild coronavirus cases, how do they know it's the new COVID-19 if it's not the severe and it's not just an old, like a cold or another coronavirus that has been around for a while? How do they determine that it's the new coronavirus they're testing positive for? And if you would have tested people a year ago, they would have tested positive for coronavirus, but not the new one, not the COVID-19, not the serious one.
Okay, doctor, I don't know if we lost you there for a second. I don't know if you heard the whole question. Is how do you know if it's the new coronavirus, the COVID-19, versus an older version?
No, and that's a great question. I hope you can still hear me.
Yep, hear you fine.
So great. So that the important part about understanding the way that we test for coronavirus is that there's pieces of DNA we're looking for. That DNA is found in a typical viral panel that we can do, and that viral panel is something that we do in children a lot who are admitted into the hospital, that looks for the typical coronavirus. That gene that we're looking for our special testing is not necessarily able to be detected on the typical panels we use for this test.
Okay, doctor, I hate to break it off with you right now, but we're going to take a real quick break. I'm going to come back and let you finish that answer right now. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. We'll be right back. Welcome back to our coronavirus pandemic special report. Let's bring back the doctor in, Dr. Mundeep Kainth, a pediatric infectious disease specialist from Cohen Children's Medical Center. She's been answering your questions. Before the break, you were in the middle of your answer as to how you distinguish between COVID-19 and earlier versions of it, and I cut you off for the break, so I'll let you finish that.
That's okay. So just to clarify, there's two different tests that are done. For COVID-19, there's a special test that looks for the genes of the virus. Our typical viral panel that we do in children does include coronavirus, but those are looking for different strains of the genes. So those are 4 typical cold virus genes that coronavirus is coding for, whereas COVID-19 testing is specific for the gene that looks for the particular virus that has mutated and is now new in the population. So we are only able to determine coronavirus based on this very specialized testing because of the gene target on there.
Okay, back to the phone lines. Karen from Stony Brook. Karen, you there?
Yes, hi, thank you. I actually have like a 2-part question here. I'm a 58, 59-year-old diabetic, and I'm wondering how unsafe it is for me to venture out to the food store knowing how the carts are made of metal and with the understanding that the virus lasts about 9 days on metallic surfaces. And my second part of the question is, I just found out today my neighbor has the coronavirus. How likely is that virus to be contracted from her mailbox to my mailbox via the mailman?
Great questions. Doctor?
So I'll take the second question first. So we do know that coronavirus lives on surfaces for some amount of time, but we actually don't understand how infective it is, meaning that we don't know if those virus particles are actually viable and can actually cause infection. So if the mailman is touching one mailbox to another mailbox, um, even if there's virus on any of those items, we're not really convinced that those items are actually carrying virus that's able to infect anybody. That information is really lacking at this point. The other point about surfaces and grocery carts and shopping, and I think that's a really great question because this is a kind of where we have to start thinking about how our habits have to be a little different. So you may go to a grocery store and not necessarily think about your shopping cart in the past, but they have wipes now at a lot of entrances to shopping stores. You can always wipe down your cart, but you also are now have to think about how important it is for you to make that quick run to grab that one thing, as opposed to stacking up a nice, good shopping list and making sure you're not going as frequently. And there are now hours available at many stores where they're using morning hours when they first cleaned and disinfected their entire store, which is now actually mandatory state policy before opening. So now that stores are actually being much more careful about how they're disinfecting and cleaning most high traffic surfaces. And so that means that those times of day where there would be less people around would be a good time for you to venture out, or at least the times that are really just for those people who might be at higher risk. And there is a list available on websites for these stores if you look around.
Yeah. All right. Let's bring in Eddie from Oyster Bay. Eddie?
Yeah, hi, doctor. I'm a veteran from the 70s, and we were in basic training with the vaccine gun, probably given 30, 40 shots before going overseas. And on the veteran websites, they're saying that we're better prepared for the COVID-19 than other people.
Doctor, are veterans in a class? Is there something that they better helps them with the virus?
I'm not aware of anything in particular for our veterans. Only that maybe, if we have those who may have been deployed to sites where they may have already been infected in the pandemic, we're still trying to understand how antibody responses work and how effective those antibodies are in people, meaning antibodies are proteins that we make as a response to an infection. So I think that's information that even back in China and in some of these other countries, Italy, that have already seen a lot of new cases, we're still trying to understand where our immune system plays a role in protection.
Okay. Real quickly, if you can, in about 10 seconds, are our hospitals prepared for a bigger influx?
Yes, I believe hospitals have used a lot of what the CDC is also using in terms of pandemic preparedness to help them understand ahead of time what was needed for something like this that may happen. So okay. I do believe that there are many people in our healthcare administration and healthcare workers who are worried and concerned, but okay. I believe that we're learning more and we'll be able to help.
Okay, I apologize. I have to cut you off again. That's all the time we have for tonight, but join us again tomorrow night at 7.
Okay, great. Thank you.